What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering X-ray tech versus nursing. Which one is more physically demanding? So to give you context, I'm a night shift X-ray tech. Been doing it for about over 4 years at a trauma 3 ER. And I know what you're saying. You're like, Miguel, what do you know about the nursing world? Well, my lady is a nurse, so I get told, and I've asked her many questions about various topics. I've been with my lady for over 10 years. She's been a nurse for like 8 of those years, so I'm pretty well educated and seen a lot of stuff even at work for that. So I have a pretty good base knowledge on it. So I would say that technically the nurses have more patient care than we do. And you could technically say in certain aspects, nurses have more physical stuff to do as far as like rolling patients over, doing wound care, doing like assessments with the doctor, maybe helping them go to the bathroom, doing all like the basic patient care that we don't really deal with. So I guess in that aspect, they have a little bit harder. But then again, at our hospital, at the emergency room, there's a bunch of nurses. As long as you have a buddy with you, you can get some help. To give you a perspective on the ratio, if you're a student or if you're new or you just don't know, there's 2 X-ray techs, 1 CT overnight, and there's about, I want to say, about 100 nurses at the hospital. Maybe every single unit has probably 20 to 30. Maybe their emergency room, maybe like 15. But there is way more of them than there is of us. And I know you're like, Miguel, everyone's in the medical field. They should help each other. Well, not always. So just keep that in mind if you want to know. And I know, and I'm going to just let you know off the rip, if you're a dude, and regardless of which field you are in, if they need help moving people, you will get dragged and used a lot. I'm just putting that out there. Just letting you know. Because there's like a dude nurse at our place, and he's kind of buff, and he get dragged all the time. And he's like, sometimes, Miguel, I wish I wasn't buff, because I get dragged at shit. I'm like, it's part of the gig, bro. We lift at the gym, and then you just get dragged into stuff. Just putting that out there. Now, it's like the more patient care we would have to do, I would say, is like when you work in the fluoro or in the main radiology, you do more patient care there. But even then, sometimes the nurses are in there helping you. Sometimes they're not, but not as much as the nurses do. So they have it in that. Now, as far as like traumas and stuff like that, sometimes we're fortunate enough and they have a trauma bed, and it makes our job way easier as long as they're lined up and their body doesn't cross over any like bars and stuff like that. You can just maneuver and it'll be an easy day. You don't have to do as far as where the nurses have to roll them over, check for the bullet, or like roll them over to help try to get the wound, or like try to do all their nursing stuff like that. We really don't have to do that. Even if we kind of have to move them, we can like cross table and avoid even moving them in that aspect too. Because like sometimes we'll be in traumas and we won't have a trauma bed and we'll be there struggling. And the nurse is like, let me just give some pain med, some vitals or something like simple. And they won't be struggling as much as we do. So it's like, it kind of depends on what situation you're in. But as always, there's more nurses than there is X-ray techs. So, but sometimes I will say that depending on, like, I don't know, like my lady's done home health. And I know in home health, they have to do a lot more as far as rolling. Like, there's more patient care in home health. And as far as even our people in radiology who do mobile, it's more of a just finding ways to adjust the board and placing it behind the patient if they're in a wheelchair or if they're standing, or it's like, so I can't really say much on that aspect. Because like my lady, I've seen her, she'll be tired, more tired than me half the time. So I could say that I'll be chilling more, and like even on my busiest days and my more hectic days, I'm still okay. But then again, I work out, my lady doesn't, and I have more strength than her. So maybe something that would be really tolling on her wouldn't be as much on me. So it all kind of depends on how. But then again, there's some big people who come into the hospital, some like 400, 500 pound. And I've sat there from like them getting checked in all the way to where we have to come in. And they'll just be doing vitals, they'll do this, they'll do that, nothing involving physically moving. And then they're like, you got a femur, Miguel, or you got a hip. And you're over here like shoving the board and like using your shitty equipment, hope it works, and is struggling. Maybe have to re-pull the equipment out, run, go get another shitty machine, and then do it again. And in certain cases, we have it more physically challenging than the nurses do. So it all really kind of depends. I can't give you an exact, it's just more of the case by case. So hopefully that kind of gives you a realm of which one is. I know that they got to do a lot of restocking and a lot of like, even we'll be chilling more. And even when we're chilling, they'll be doing a bunch of restocking, going around, but that one's not really physically demanding as much, but they'll be more active in doing stuff. Meanwhile, we'll just be chilling, waiting for an order to come in. And the most we restock at our department, even in the emergency room, is maybe like just some sheets and like the gloves, but that's not even nothing compared to what the nurses deal with. And so if you're new to the channel, I hope you enjoyed today's video. You can check out my channel. I compare nurses, X-ray techs, respiratory, ultrasound, all aspects of this beautiful field of radiology and other comparisons you can check out. I made a playlist. And yeah, we'll see you on the next one.